Guatemala, a country of more than 16 million people. With one large city and a densely populated interior, the country has struggled to contain the pandemic, with nearly 145,000 confirmed COVID-19 cases so far. This despite tough measures taken at the start of the health crisis. Last March, as COVID-19 cases began taking off in the Western Hemisphere, Guatemala was among Central American nations to shut down its international borders, hoping to seal itself off from the global pandemic. The national quarantine here lasted for 6 months. However, Dr. Zulma Calderon, the health program director of Guatemala's Human Rights Commission, was unimpressed with the policy's implementation.
The border closure was not a strong barrier. Guatemala has a number of clandestine crossings along its frontier, mostly with Mexico, which were not controlled by the authorities. There are problems with contraband moving through those regions, and they became hotspots of contagion as well.
The Guatemalan government promised a country-wide test and trace system, but the local officials we asked in rural areas said the only visits from the national government were campaign stops ahead of the June 2020 presidential elections. And while land, air and sea borders were shut, controlling the population has proven difficult. Andres Lemos is the spokesman for the Guatemalan Red Cross.
At the start, people were very observant of the lockdown and use of face masks. But when cases started to drop and regular information from the government stopped, people began to take risks, to the point at which our hospitals are now full.
So in the case of Guatemala, health professionals here say closing borders was the right move, but it wasn't enough.
Closing borders is fundamental, but it has to be done correctly. It's about forming an epidemiological fence according to the technical protocols, isolating confirmed cases and tracking those they have had contact with. Simply closing the border didn't work because there was no follow-up of proper containment, and that's why we're facing the situation we have now.